Welcome to the EMS Incident Command Channel, the channel to help you become a more informed and stronger leader, officer, and partner throughout your career. We are offering educational and informative videos to help you improve yourself. We are going to discuss the importance of taking a thorough but rapid medical assessment. As a paramedic or EMT, obtaining critical information quickly and efficiently is essential for providing effective pre-hospital care and an important tool in our toolbox. We understand that every medical emergency is different and would be tailored to the incident at hand. We also know that it is nice to have an idea of what you need to ask for every incident. In our line of work, there is a lot more gray during our runs than black and white when treating patients. We know that we just need to work within our standing medical orders and protocols in our regions. When responding to emergency calls or providing medical assistance, here are some important questions to ask a patient. First thing you want to ask a patient is, what is your chief complaint? What seems to be the main reason that you called today? What are the symptoms or issues you are experiencing? When was the onset? When did the symptoms start or the incident occur? What were you doing when it began? Does anything make you feel better? If they are complaining of pain, we do a quick pain assessment. If the patient is experiencing pain, ask about the location, intensity on a scale from 1 to 10, and any factors that make the pain better or worse. We can use the PQRST acronym: provoke, quality, radiating, severity, and time. Do you have any pre-existing medical conditions that we should be concerned about, like diabetes, respiratory, cardiac, hypertension, cancer? Have you had any recent surgeries or hospitalizations? Do you have any medical devices such as pacemaker or insulin pump? Do you think that anything in your medical history can be contributing to what is happening today? Are you currently taking any medications? If yes, what are they? Have you started any of these medications recently? Did you take them today? Ask about allergies. Are you allergic to any medications, foods, or anything other? Ask what was happening prior to event. If the patient experienced an injury or illness, what might have caused this incident? If possible, ask the patient, family, or bystanders about any events or activities that occurred before the emergency situation. Have you experienced this type of incident before? Inquire about the patient's last food and fluid intake, especially if they might require specific treatments or interventions. Changes or loss of consciousness. If the patient appears altered or confused, ask if there has been a recent change in their level of consciousness or awareness. Make sure to ask the family, what is the patient's normal mental status? If this change is new, when did it start? Inquire if the patient lost consciousness or experienced any other neurological symptoms. History of present illness for non-emergent situations. Gather more details about the current problem or symptoms. Ask about the progression of symptoms and any associated factors. For patients with injuries, ask if any recent trauma. Ask about the mechanism of injury, like a fall or car accident, and any injuries sustained. Ask about any recent use of drugs or alcohol, as this can impact treatment decisions. All questions should be asked with a sense of urgency while being compassionate and reassuring to help put the patient at ease. Remember that in emergency situations, time is critical, so prioritize obtaining information that is crucial for immediate patient care. Also, be prepared to adapt your questions based on the patient's condition and the situation at hand. Once they tell you what the complaint is, set your questions appropriately to begin preparing your treatment and work efficiently. Effective communication and quick assessment are key skills for a paramedic to provide the best possible care in emergency scenarios. With experience, your questions will become more natural and direct. We begin to have a spidey sense the longer you work in this career. Don't ignore that, because it will make you the best paramedic you can be. Is there a topic you would like us to cover? Let us know in the comments. Please like and subscribe. Don't forget to hit the notification bell for more EMS educational and leadership videos. Until next time, see you out there.